Any questions? Yes.
I was wondering if you had a lot of sputum and that, could it be from having too much dairy products?
No, that's something I can say has been well and truly discounted, and that dairy products don't increase mucus hypersecretion. Mucus hypersecretion usually means there's inflammation, and the mucus glands become overproductive when there's inflammation. The easiest way to think about it, if you get sunburn or a gravel rash, it weeps, and that's what's happening on the inside of your airway. So if I put a telescope down inside your airway, when people have chronic cough and mucus production, they're inflamed. And what you will do is try and find out why are they inflamed, and how can you reduce that inflammation, and how can you make that mucus more easily cleared. One of the things that, again, I talked to you earlier, that you can be taught to breathe more efficiently. We can also all be taught to cough more efficiently. People often cough inefficiently and can exhaust themselves in the process and even break ribs. And so learning how to cough in a way that is actually more efficient and less exhausting is something that an expert therapist can actually teach you. But no, milk products are safe.
Yes, at the back.
Oh, that's just a TV.
No, the people will listen to the book here.
I'll put it into a book. No. I have published an article, but it was actually in with the Post-Polio Network in Queensland. We published it in the Medical Journal of Australia in 1996 with a girl called Penny Beeston, who was then the education officer for Post-Polio Queensland Network. And we did that specifically as a way of trying to educate GPs. And so we published a generic story of previous polio. And we have presented most of this data at national and international conferences to doctors, though, to try and educate the medical community. But we've never published anything as a lay booklet as such. But I think that this is really the network, the Polio Network Australia, has now got a group of experts who are putting together a series of documents which they're going to roll out, and it's both for the lay as well as for the medical public. And I think that we should put anything through that sort of authority, because they've got the opportunity to really roll this out in a way that will be listened. In the past, I think the risk of having little groups fragmented all around Australia was there was not one single strong voice that was getting through. And now I think we've got that voice.
This is what I found. When I was 17, way back in 51, and got quite well, but I really wanted some articles or diagrams and research, and it's the American Dr. Halstead, his 2 books. I found so helpful.
Yeah.
Explained all these little bits and pieces. And also Victorian people put out a book on, I think it was titled, but it was this group of people who had put around their stories and how they got on.
Yeah.
Those 3 books have really opened up to me.
Yeah.
And I've worked out quite a bit myself, so it's a big help.
Well, I agree with you. I think individual stories help, and how people have addressed their issues or their problems. So, what would be more powerful to the community out there is not just this, but your story about your swallow problem and what helped and what got you through, or what medical resource was available to help you deal with that. That's really what both the medical and the non-medical community need, is that sort of information. But I agree that the American literature has been very helpful, even to me.
I just wanted to know what the impact with your diaphragm if you've got hiatus hernia.
Okay.
What does that have any effect on your respiratory?
Okay. There are 2 types of hiatus hernia. There's a rolling and a sliding. The commonest is the sliding. The rolling are quite serious and probably need surgery. because it means there's a major defect in the diaphragm and the risk of incarceration of the stomach is severe. With a sliding hiatus hernia, which occurs in 30% of the normal population, the greatest risk from that is gastroesophageal reflux and its effect then on the upper airway and on the lower airway. However, some of the hernias can be so large, they can be like a large grapefruit or a small watermelon, that they could impact upon ventilation by displacing some of the lung. They're relatively rare. They probably need to be referred to a tertiary gastroenterology service for an opinion, because they may require surgical repair. But the commoner ones, which are smaller and sliding, the greatest risk is reflux.
Mine's a large rolling.
Right. A large rolling usually is an expert gastroenterology
It said
service.
no surgery.
Sometimes the risk and benefit is the issue.
Any other questions? Yes, up there.
Thank you. Earlier you said it was better to sleep on, was it the right or the left side? I didn't write it down.
Right side.
Right, thank you.
Just because of the mechanics of things.
Yes.
Doctor, is it possible that a sleep test has been done and they misdiagnosed what the real situation was?
It is, for a number of reasons. First of all, sleep medicine has got a little bit mercenary, and not all the sleep clinics have the patient in mind and are more money-making enterprises. And so you have to be very careful that you're seeing a bona fide one that really is interested in you. So some of the bulk billing ones are just money-making exercises. The second issue is that a study is inadequate if you have slept for less than 4 hours and if there was no REM phase sleep. And so some people are just too restless or can't settle and don't get that critical period of time. The third is that if we're looking at issues of leg movements or under breathing, not all the sleep units put on the leg electrodes or measure the carbon dioxide level through the skin, and they may not have measured the right thing. And so, and again, it's more the bulk billing ones that are just trying to churn things through that are more likely to miss the more subtle diseases that we see in polio patients.
So one last question. Yes.
Have cramps got anything to do with polio sufferers or not?
They do seem to occur in anyone with a neuropathic disease. Certainly I see a number of polio patients who suffer from cramps. I can't remember what the figure was in our Western Australian survey. I think it was around 20% had cramps. You've probably got data on that. My simple strategy, first line therapy, is magnesium aspartate. 1 gram, which is 2 tablets at night, and has a 50% cure rate. And then there are more complicated things after that, but it's so simple, so safe, you don't even need a prescription because you can buy it over the counter, and I find it very useful. So that's my first line treatment.
Magnesium, 2 tablets.
Yeah, magnesium aspartate, 500 milligrams, 2 tablets at night.
At night,
Yeah.
after food. Thank you.
Now call on Will to move the vote.
When I get my balance. I usually can manage to think of important things that a speaker said to pull back on in thanking him, but I think today there are so many things we've been trying to take in that I'm not even going to attempt that, except, guess what? What do I say every time? Why aren't you giving me, as the collector of your stories, why aren't you giving me your stories? Look, you've got a most important speaker telling you you've got to give me your stories. So I expect more. Actually, we haven't been collecting in our stories so much what kind of treatments and things in there later. What we're mainly getting people's stories, and that's why it's called How Will They Know, is that people do not understand what the acute polio is like. and people are writing about their experiences of that. But now you're giving me the idea we've got to add more, and that's very important. And I don't know what George got for us to give you, but as a token of our thanks for you coming all this way and giving us so much time, remember us with that.
Thank you very much. Thank you. I will have to go, but I do appreciate the opportunity, and really, you're the special people here today. I do hope it's helpful. I have given the slides to the team here, so it's on their computer, and I'm happy for that to be disseminated as you see fit. And I hope see some of you at other polio gatherings in the future.
Thank you.